Welcome to all my students once again. Now let us discuss some aspects of special forms of inflammation. I know all of you know what is inflammation. The cardinal signs of inflammation being lumbar, calar, dolor, tumor, puncture. These are it means redness, heat, loss of function, and there will be a tumor there, right? So the first and foremost which comes in the case of special form of inflammation is wound abscess. So an abscess is a cavity containing pus. It's a purulent discharge, contains what is called pus. And most predominantly, abscesses are invariably caused by Staphylococcus aureus. So what happens is, when this organism enters the body, what happens is, it stimulates the inflammatory response. And thereby all the mediators of inflammation are released. Initially the neutrophils, then the macrophages, all this comes into play. And what happens to all this thing? Because of this inflammatory plant, all this dead and dying WBC will form into purulent material, fibrotic exudate will form, purulent material, fibrous exudate will form, surrounded by what is called as the pyogenic membrane. So separation occurs, a pyogenic membrane occurs, and when you see for this abscess, when you palpate, yes, definitely, when you on inspection there is redness over the area, there is increased temperature, pain, and definitely there is swelling, and then puncture, disorder, which loss of function will be there. So what happens is, all this inflammatory, be it reticuloendothelial response or increased permeability of all this occurs in the form of inflammation, and as a consequence to it, the toxins are released and the tissue destruction occurs. And most importantly, when necrotic tissue does occur, the patient is very ill to be examined, and he has a severe throbbing pain. Pain can be stratified in so many ways, but throbbing pain is the most characteristic feature of any abscess formation, right? And most importantly, it is because of the increased amount of purulent material increasing, which is impinging or pressing upon the nerve endings. So what happens to the pain? Apart from the pain, you also have a severe fever, chills rise. So all this calar, dolor, tumor, all this loss of sensation, all this loss of function, all these things are met in the case of an acute abscess. So what is the treatment of this acute abscess? Incision and drainage. What we do is, either under general anesthesia, the small abscess you can also do it under local anesthesia, but always a general anesthesia is preferred. So under general anesthesia, what we do is, we take a surgical blade under number 22 or level blade, and the summit of the abscess cavity, we make an incision and we let out the pus. Once the pus comes out, what happens is, we irrigate the whole abscess cavity with hydrogen peroxide and normal saline. What does hydrogen peroxide do? Hydrogen peroxide will definitely release what is called as the nascent oxygen, and with that nascent oxygen will nicely sterilize the whole. It has got a hygroscopic effect, thereby the abscess, the purulent material nicely comes out. Then we inject betadine and along with hydrogen peroxide, right? So this is all. Nascent oxygen is the one which helps us to completely pour out the abscess cavity. And most importantly, what is happening is, after the abscess is drained, what we do is, we put a drainage tube inside. So in the course of one or 2 days, all the abscess cavity is completely evacuated. Now what do we call, in this only we have what is called the modified Hilton's method of abscess drainage. A modified Hilton's method of an abscess drainage. What do I mean by modified Hilton's method? This is done in the areas or the vicinity where some important structures, vital structures are there. For example, the axilla, you have got an axillary, the parotid, you have got the facial nerve, and in the neck, you have got the subclavian veins and the brachial plexus. So in order to achieve this, what we do is, we don't give a direct stab incision. We keep on infiltrating the skin and the subcutaneous tissue, and then we layer by layer, we open, and as we come to the abscess cavity, we incise the abscess cavity, wherein we drain out all the pus there. Now, what is the differential diagnosis of an abscess? Number one can be a ruptured aneurysm. What do I mean by aneurysm? Aneurysm is a segmented dilatation of an arterial system. Is called aneurysm. A soft tissue sarcoma. What do I mean by a sarcoma? It's a very hard. See, we are all there to the ectodermal, endodermal, mesodermal cells. The malignancy which is arising from the ectodermal cells, the squamous cell carcinoma, the malignancy which arises from endodermal cells is adenocarcinoma. The malignancy which arises from soft tissues like the muscle, the skin, the bone, all this thing is called as a sarcoma. The soft tissue sarcoma can also be a differential diagnosis for an abscess. And next comes what is called as an antibiotic. That is antibiotic induced swelling is called as an antibiotic. When antibiotics are given in place where there is a pus, what happens is it gets partially sterilized. And most importantly, antibiotic, there is a lot of fibrosis which occurs and forms into a mass. Clinically, you can find it as a very hard lump. And most important areas where it can be seen is the breast, the thigh, the ischial fossa, all these areas where you can see antibiotic manifesting. Acute infections. Now, infection and hemorrhage has been the most scourge of infections, and hemorrhage is still the enemy for any surgeon. But after the advent of nice antibiotics, they come into present day. We are now the infection stage are coming in. So one of the first thing what we talk about infection is the cellulitis. 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 So cellulitis is a spreading subcutaneous infection and inflammation produced by hemolytic streptococcus. Specifically, I just underline that, produced by hemolytic streptococcus. Right? How do this streptococcus organisms produce? They produce substance which is called hyaluronidase and streptokinase. You would have heard about this hyaluronidase and streptokinase in your earlier microbiology classes. So what they do is they break down the subcutaneous tissues and they allow the subcutaneous spread of the inflammatory tissues. It goes on increasing in size. The whole affected body becomes enlarged, and especially this is more common in area the loose tissues like the subcutaneous tissues, like the scrotum, interstitial tissues in the face, the forearm. These are common. This is cellulitis, right? Most common cause for a cellulitis is the diabetic cellulitis or post-traumatic cellulitis. Diabetic cellulitis is the most important cause. Now, what is the source of infection for this? Source of infection can be any trauma, it can be minor source, it can be major source. A scratch also can produce what is called as cellulitis. Severe scratch can produce this thing. Or a scorpion bite, snake bite can produce cellulitis. The precipitating factors can once again be malnutrition. Malnutrition is still the unwanted thing which is happening in our country, right? We don't want the malnutrition state. Still, we have not achieved a state to call ourselves a developed nation, because most of the children you see that are children are very, very malnourished. It's not being addressed. Let's not enter into that aspect. Low resistance individuals. Who are these low resistance individuals? Those people who have diabetes, or persons who are having malignancies, undergoing any treatment for malignancies in the form of the chemotherapy or radiotherapy. And most common sites, as I said, the lower limbs, the scrotum, the face, all these things are the most common sites where these things can occur. So on clinical examination, you can see a diffuse swelling which is occurring, and there is evidence of inflammation with the redness there, and skin gets stretched, pain, fever, and toxemia can be there. If untreated, what happens is it can go on to the whole area can get sloughed off, or because of the increased pressure inside, it can undergo gangrene formation because of the compression of the vessels. So treatment for first will be bed rest. In case of food, we will have to elevate the frequency. Then what most important thing is, you get what is called as a glycerin magnesium sulfate, glycerin MagSul, glycerin MtSO4. It is a hygroscopic effect That means he sucks up all the inflammatory or by hygroscopic effect. So, and for the diabetes, you must give them on insulin. You must put them on injectable insulin, act rapid or whatever it is. Act rapid is on 6 hourly. You can give act rapid. Earlier there used to be bovine insulin or porcine insulin. But now the human act rapid is coming to go. In snake bites, it is there. You must always give a polyvalent anti-snake venom, polyvalent anti-snake venom. The complication of cellulitis can be, it can get turned into an abscess, it can turn into an abscess. Or most importantly, if it is not treated, the sloughing off of the area occurs, and mostly they go into severe toxemia. As a consequence to it, they may also go into severe septicemia. They go into severe septicemia can lead to multi-organ failure. The person may die because of a multi-organ failure. What are the characteristic differences between cellulitis and abscess? Cellulitis, definitely there is no well-demarcated edge. Whereas, in important distinction, abscess has got a well-demarcated edge. Well-demarcated. Cellulitis has got no limit, whereas abscess has got a limit which is present. And most important, cellulitis seldom will have any pus inside. But abscess definitely has a pus inside. There is no fluctuation in the case of a cellulitis. There is fluctuation in the case of what do I mean by fluctuation? You hold the swelling with both fingers, index finger and thumb of right hand index finger. You press on one side of the swelling, and because of the pressure, other side the fingers go apart. That is called as a fluctuation. The muscles are fluctuating. So the treatment here will be, you will have to give multiple, suppose if it's a leg, you give multiple vertical incisions and try to drain off all the subcutaneous fluid. So that what happens is, it is nicely decompressed. Give them broad spectrum antibiotics. Regular dressings with magnesium sulfate and hydrogen peroxide. Regular dressings will be given to glycerin, magnesium sulfate, hydrogen peroxide will be given to them. Then the next entity is called Ludwig's angina. So what is this Ludwig's angina? The cellulitis of the submental and the submandibular area. There is inflammatory edema in the submental and the submandibular areas. So again, the organs of the culprit is the virulent streptococcus organ. Anaerobes also do play a major role in Ludwig's angina. The most important is the precipitating factors for this can be a carious tooth can be a precipitating factor. Any cancer of the oral cavity or calculi in the submandibular gland, or more importantly, cachexia. Cachexia is cancer cachexia, where the person is not able to eat well, is daily going down in his weight, is not able to eat properly, so it's a cachexia, cancer cachexia. Diabetes, again, they can have a low immune system, so diabetes is most important. So here, you have an elderly patient coming to you with a history of swelling noticed in the region of submandibular and submental area. There is a called as a brawny edema, B-R-A-W-N-Y, brawny edema of this place. So edema can be seen apart from the subcutaneously in the submental. It can be seen in the oral cavity also. And they have difficulty in swallowing. High grade fever will be there for these people. And putrid halitosis, it's foul smell will be there. So the treatment for this will be rest and hospitalization, appropriate antibiotics, intravenous fluids will be given to these people, and rise to feelings and harm people. Surgical interventions are most important. So under GA, what you're doing, you take a 5 to 6 centimeters in the submental area, and you would take the incision deeper and open up all the subcutaneous plane, wherein all the fluid which is there comes out of that. So, once the edematous fluid comes out, what happens if you don't do that? It comes upon the trachea and produce severe stridor. So, and it can lead to mediastinitis also, or it can lead to edema of the glottis. This is how you treat a case of Ludwig's angina. Ludwig's angina can be asked as a shock. Any of this can be asked as shock note, abscess, cellulitis, and Ludwig's angina can be asked as shock notes. I feel that.